Today we'll read about OPD instruments used in ENT department. In this class we'll read about only OPD instruments. In further classes we are going to read about surgical instrument. The first OPD instrument is Tillet's nasal forceps. So like how you'll explain the instrument, you'll say it is made up of stainless steel, about its joint and all. So in Tillet's nasal forceps, how it is having an obtuse angle and there is presence of box joint. Can you see? There is a presence of box joint. Why it is an obtuse angle? To prevent a line of vision, it is an obtuse angle. Where it is being used in nasal packing, ear dressing, removal of foreign bodies. Then comes Hartmann's nasal forceps. It's like similar to Tillet's nasal forceps, but it has Creve joint and it has serrated. You know what is serrated? This is known as serration. Okay, serrated and grooved jaws are present. Grooved with serrated jaws are present. So that is how you can differentiate Tillet's with Hartmann's. Both uses are same, like nasal packing, ear dressings, how help in removal of foreign bodies. Then ear spacula. See, ear spacula, we don't have its picture, but how ear spacula looks. Ear spacula is something like this. They are in different shape, like used in the examination of external auditory canal, tympanic membrane, middle ear. So these are ear spacula. Then we have otoscopy. Can you see? This is an otoscope. This is an otoscope. It helps. It has its own illumination, a source of light, and it provides magnification. Okay, so it helps in the examining of external ear, tympanic membrane, nose, like examination of nose in the infants and all. Then we have tuning forks. Obviously, you will get to know tuning forks very easily. So if they ask what is this, is made up of stainless steel and it is a tuning fork. Then we have oral syringe. I don't have that picture, but you will get it. It's something syringe type, cleaning of ear wax. This oral syringe. Then we have a laryngeal mirror. This you can see, like whenever a person in the OPD comes with throat pain, severe throat pain, then you see your professors or PGs using this. This is known as laryngeal mirror. Okay, it will be about 6 to 30 mm. Helps in the examination, indirect examination of oropharynx, laryngopharynx and larynx. Then we have Thuidum. Can you just see this structure? This is Thuidum nasal spacula. It is something like this. Okay, it is U-shaped metal ring with two blades at the end. The size depends on the patient, age of the patient. Okay, it helps in the examination of nose during surgery. This is also very important. Then we have L-shaped depressor. Can you see this? This is L-shaped depressor. Okay, it's also called as lax L-shaped depressor. It bends the end. One is depressing and one more is support. Okay, so it depresses about anterior 2/3 of tongue to know the structures of the anterior 2/3 of tongue. If you go on touching the posterior part, there will be gag reflex. So this is question, like a disadvantage of it, like gag reflex. A patient can't control it. When you will use in case of squeezing of tonsils, retracting the cheek, test for gag reflexes, checking post nasal bleeding is seen or not, or any loss of teeth is seen, posterior rhinoscopy examination, nasal air blast. For all these is used. Then we have the very interesting. So these what I've explained in these are very important. Okay, ear spacula, here you can see these are the ear spacula. So just go through because its instruments is very important in ENT. So this is laryngoscope and rhinoscope. then and mirrors of a handle. So laryngoscope and rhinoscope, you can guess it. Laryngoscope is a straight line, rhinoscope is something. Then we have Jobson's Horns probe. What is Jobson's Horns probe? Can you see here is a cotton, okay, and here is a ring current. It is used in wax removing of foreign bodies. One side, that is John's horn scope, is used for applying cotton to clean the ear discharge, and other is removing wax of the foreign bodies. Then we come to the last point, that is eustachian tube instrument. So here we have the important one is eustachian catheter, which is 12 to 15 centimeter metallic cannula. Okay, its base is having a ring like structure, okay, which indicates the direction of this curved surface. Then we have polyters. These are polyters. Can you see? These are different types of polyters. These helps in inflecting the middle ear, installing medicines in the middle ear, remove foreign bodies from the nose for the successions of some discharges. So these are the important ENT only OPD instruments. So in the next classes we'll learn about surgical instruments. Okay.